We know guys will go to extreme length to put extreme length on their penis.
Yeah, for the most part, all the pills.
No pills.
It's all nonsense.
What about the ads on the side?
Bullshit.
What about the Pneuma implant? I heard of that.
So that is something to talk about.
What's up, everybody? I'm JC Mendoza. Welcome to Uncomfortable Questions, where I get to ask a doctor questions about things we're all dying to know, but might be too embarrassed to ask. With me today, of course, is Dr. Peter Stahl. He is a board-certified urologist and a nationally recognized leader in male sexual medicine. Dr. Pete, it's great to have you here.
Awesome to be here again. Let's go.
We both know that guys will go to great length and they'll search far and very wide to find answers about making their penis bigger, penis enlargement. So I have a bunch of questions. Question number one, gas station pills, how much money should I be spending on them?
Yeah, zero.
Zero, okay, that's a little bit, that was under my budget. What about those ads like in the side of the adult videos that says, oh, if you give me this money, I'll give you the secret to the
Yeah,
male.
bullshit.
That's disheartening. What about surgical options?
Let's get into a real discussion
good. I'm
about this, because there are surgeries that enhance penile length and girth, but you gotta really approach that stuff cautiously, carefully, and with eyes wide open. And I've seen lots of people in my practice who rushed into surgical procedures and were dissatisfied with the results, who ended up with complications that actually had pretty severe, permanent, and negative impacts on their sexual functions. It's, first of all, sexual partners care way less about length and girth than most men think they do. And a lot of the patients that are seeking enhancement surgery don't even have small penises. I think they have many people I think have a distorted view of what's normal, what's expected, kind of unrealistic expectations for what they want.
You're reading me like a book, doc.
Yeah, maybe.
What about, I have seen something about the Pneuma implant. What is that?
So the Pneuma implant is a new medical device that was developed to enhance penile girth. So it's a piece of silicone that basically gets wrapped around the outside of the internal structures of the penis. So it's superficial enough that it doesn't interfere at all with the erection chambers, penile function, but it's deep enough where it doesn't feel like it's just right under the skin. So it's basically a silicone wrap that enhances the girth of the penis.
Okay, that's cool. Extra girth. What about length?
Does absolutely nothing for erect penile length.
Okay.
But as everyone knows, with shrinkage, the penis has a pretty remarkable ability to go from very long to very short.
Especially
right?
after I get out of the pool.
Right, ambient temperature, stress, fear, whatever it is. And the implant itself is silicone. It's not responsive to this, to temperature really. So it does maintain a minimum flaccid penile length, and some people with Pneuma implants like that.
Okay, so does it affect penis function at all, like for good or for bad?
Not if everything goes right. So, in the best case scenario, the implant's put in, it has this effect on penile girth, flaccid penile length, and that's it. It's a purely aesthetic procedure that's put in really to enhance confidence and aesthetics.
My big Pneuma walk?
Your big Pneuma walk?
Is that how people walk into your office when they have the Pneuma? Hey, Dr. Pete, I'm back, I'm different than I was before.
So actually, I don't put in Pneuma implants, right?
Okay.
So when people walk into my office with a Pneuma implant, they're usually walking in with their head down and they're upset because they have a really bad complication, right? So I'm the person that, is the expert that manages.
Right, you deal with post-Pneuma penises.
I guess so, post-Pneuma
For
penises.
Dr. Pete.
Yeah.
Right.
A lot of P's there. I'll tell you what I've seen, right?
Yeah, people that do come in.
What I've seen are the rare and bad complications of Pneuma implants. So, in the immediate post-operative setting, you can get what's called a seroma, which is just fluid underneath the implant. That's not a big deal. That just needs to be drained. Usually that can happen in the office, and usually that's the person that put it in deals with that. But the more serious complications are infections, scar formation, erosions, sometimes penile sensory loss. Scar formation is when the implant gets stuck to the underlying natural tissues of the penis. That can entrap the nerves that are responsible for sensation and result in penile numbness or other discomforts that can be difficult to treat and manage. Sometimes it requires freeing up the nerves and removing the implant itself. That's really rare.
Okay.
But I've seen it, and that's a potentially bad complication of a Pneuma implant. An erosion is when part of the implant actually starts sticking out through the skin.
You gotta get surgery to fix the surgery.
Yeah, infections are very rare with Pneumas, but if that happens, the whole thing needs to be removed. Bottom line is, the Pneuma is a real medical device.
Right.
It works to enhance penile girth. It enhances flaccid penile length, but it has rare but potentially very serious consequences for people that get complications.
Right, well, I knew there had to be a catch. The only thing now is that I have all of these gas station pills that had a very strict no return policy, and I've put a lot of money into them. Can you push me in the direction of somebody who can take these off of my hands?
Yeah, I think there's probably some guys in the sanitation department that.
Sanitation, they'll take out the garbage.
Yeah, that's what I'm saying, man.
But you know who's not garbage? You guys watching. Thank you guys so much for checking us out. Feel free to like, subscribe, comment, and follow for more content.